Hey guys, can everybody hear me okay? Hey everybody, give me a thumbs up if you can hear me all right. Perfect. All right. Got a couple people coming in, so once I let them in, I'll get started. I made a nice little PowerPoint for you guys today. All right. All right, so I'm going to get started. I might have to stop sharing my screen here and there just to see if anybody's waiting to come in. I know there are a few people who are going to be late. Some of you guys who already know me, the introduction stuff might be a little bit boring, but just bear with me. Some people on here do not know me. And Gymnasts, this is not going to be too much of a workout, more of just like a discussion on things. So shouldn't be too tiring, but hopefully it's not too boring for you either. And if anybody has any questions during it, just stop and either unmute yourself and just shout them out, or type them in the chat and we can go from there. All I ask is that as I'm going through the presentation, just try to keep the questions relevant to what I'm talking about. And then at the end, we can have time where you can ask me anything that you want to. So, all right. So here we go. We're going to be talking today about some mobility and maintenance techniques for gymnasts and kind of how best to take care of yourself, both using some things you probably already know and have access to at home, and then also some things that are a little bit more complex. So we're going to talk about why it's important, what is most important, how this changes through an athlete's career, so how it's different when you're very young and as you get a bit older. And then what happens if you do get injured, and how do you implement these things, and then, like I said, some time for questions at the end. So just a quick disclaimer, so none of you sue me. This is not meant to be medical advice. It's meant to be general information. If you do have a problem, please check with your medical provider and do not do anything that leads to pain. So who am I? Sarah Winferuza. I'm officially starting to use my married last name 7 months later. I help athletes that are injured, but I really prefer to help them to not get injured. And I do this by employing a variety of techniques, and most importantly, helping athletes like you guys learn how to take care of your bodies and give them what they need, so you never have to come see me. So why am I doing this specifically for gymnasts? Well, back in the day, that was me, little baby Sarah gymnast, and I was always getting injured. I was on crutches here. I think I broke my ankle this time. And then on this other picture, you can see I'm quite a bit older, but have a knee brace on. And that was kind of the beginning of a problem that eventually led to 2 knee surgeries and me having to stop gymnastics early. And I really feel like if I knew some of these things about taking care of myself earlier, that wouldn't have been the case. So I want to try to help you guys from not having that happen. So after that, I stopped gymnastics. I went to PT school. It's me graduating PT school, and my grandma, she's the best. She really liked my graduation hat there. And then I went on to working as a physical therapist, and I thought I was going to be doing all this awesome sports performance stuff. And in reality, I was kind of doing stuff like this guy's doing over here, working with some older people. And the biggest weights we had in the clinic I was working in were, I think, like 8 pounds. But still, even for older people, even for our parents and grandparents, that's just really not enough. I was working with this guy. He was like maybe in his 60s. He was retired, but he was there because he had some knee pain and he was really struggling with carrying a case of water upstairs. And as some of you guys know, a case of water can be pretty heavy. So just trying to replicate that for him, I was like taping together all the weights we had in the clinic. And I just decided that it wasn't working, and it wasn't a great way to get people out of pain. So then I started working with more sports performance stuff. A lot of you know this lovely lady right here, Fiona. I don't think she's on here, but that's her. So in between there, I did a whole lot actually outside the world of gymnastics. I went and worked in a clinic where I dealt with a lot of different athletes. And it really helped me to learn how some things that other sports and other athletes do can help us as gymnasts. And a lot of times, I think in gymnastics, we kind of get a complex of that our sport and our situation is different. And while it is in some ways, it's also not in a lot of ways. And I think that we could really benefit from looking at what some other athletes do and applying them to our sport. So some things you can do, looking at sports performance training and even conditioning in your gym, you can think, I'm really strong already. Why would I ever, do more strength or more anything like that? But it's not always about developing more strength, but developing balance and technique. So in gymnastics, we do a lot of different skills, but a lot of them all look the same. And sometimes that can lead to imbalances in our muscles, where some muscles are really, really strong and some muscles are really, really weak. So that makes us pretty good at gymnastics, but not so great at other things in life, and that's where problems can arise. And sometimes, unfortunately, the conditioning we do in gymnastics, we really want to reinforce those body positions that we need, but it does feed into those imbalances at some point if we're always doing the same body positions in practice and in conditioning and all that. So balance is important. And then the other thing is we can look at how some strength training can really look a lot like gymnastics. So this lady here, if you took her barbell away and you put her arms over her head, and I told you that she was setting up for, a double back or a back layout or something, you could probably believe me. It's kind of the same position there, pretty close anyway. So sometimes developing those techniques and developing that power can really help us a lot in gymnastics. So the other things that we can do for ourselves is having checkups with a PT. Surprise, surprise. I might be a little bit biased about this, but I think it's really important even if you're not injured. So if you're like, oh my gosh, but a physical therapist is just where I go when I'm hurt. Well, think about this. You probably go to the dentist, or you should, even if you don't, every 6 months or a year. And it's not only when you have a toothache or, when you have a problem. You just go to make sure that you don't get a toothache, that your teeth don't fall out, and solve. If you have a little cavity, it's much easier to fix that than to wait until you have like a whole big cavity. So, with PT, it's really no different. If you get a checkup from somebody early on, it can really help to solve some of those small problems. And they can also give you specific, individualized, and up-to-date recommendations on some of the things I'm going to talk about. So when we talk about self-care and self-maintenance, there's always something new coming out. Probably even since I made this presentation today, there's some new technique for caring for yourself. So I can't possibly talk about everything, but if you do see a PT, they can kind of give you some up-to-date recommendations and track progress over time. So that's something that I would recommend every 6 months to a year to get checked up on. So now I'm going to talk a little bit more about some techniques that gymnasts can kind of do for themselves that are a little bit easier to do. So the first one I want to talk about is called self-myofascial release. So that's a fancy term, but really you guys are probably more familiar with it as foam rolling or rolling out with a lacrosse ball or a golf ball or something like that. So I just want to clarify first what it does not do. So some people say that it like breaks up adhesions in your muscle, and that's just not the case. It's just not that strong. It doesn't really get through to your muscle barely, and it certainly does not break anything up. Our muscles are really, really super strong and resilient. And if we could just lay on a foam roller and change the composition of them, then anytime we did anything, just sitting in a chair, our muscles would change composition and things like that. So that's just not the case. Creating long-term range of motion effects. So some of you guys have probably rolled out on a lacrosse ball or a foam roller, and you stand up and you feel more flexible or you feel more limber, and that's really great. But if you don't do anything to keep that, then it's not really going to stick around. So it just helps us with these short-term effects. It also doesn't lengthen muscles. So it's not a muscle, but some of you guys might be familiar with your IT band that runs down the outside of your leg. And for a while in like the early 2000s, it was all the rage to like roll out your IT band if it's tight, and that if you roll out, it will actually lengthen your IT band. And then they did studies where they took somebody's IT band, just an average person, and they hung the weight equivalent to like an 18-wheeler truck off of it, and it didn't actually change length at all. So that kind of proved that that's not happening. So if you can hang a truck off of it and it's not changing length, obviously, unfortunately, this person had passed away before this happened. This was not a live person. But foam rolling certainly is not gonna make it longer. But that being said, it's not all bad. And what it does do is that it decreases soreness post-workout, and it also helps with decreased performance post-workout. So any of you, especially you guys who might play more than one sport, or if you've ever had like some back-to-back practices or two-a-days or things like that, you know, after you work out, it's really hard to work out at the same intensity again right away. So foam rolling can actually help with that a little bit, and decrease that soreness. And then also increases flexibility, again, reduces soreness, does not harm your athletic performance. It improves arterial function, all these fancy words that basically just mean that it improves blood flow to the muscles. And we all know that blood flow is important for healing. And then the other thing, which is really important with this, is that it causes increased parasympathetic nervous system activity and decreases neuromuscular tone. So those are really, really, really big words that just mean that it helps you to relax. So everything in our body, even our muscles feel tight, anything like that, it all is coming from our brain, okay? And that's not me saying, oh, if you have a tight muscle, you're imagining it. It just means that if we didn't have a brain, we wouldn't feel any tightness. So something pretty crazy that I know is that, so when I'm not working at my clinic at Tummeltex, I work in a hospital sometimes, and people get knee replacements there a lot. And I don't know if you have ever seen somebody who had a knee replacement or a really big knee surgery, but right before they wake them up, they just finish the surgery and they bend their knee and they make sure that it bends all the way. And then they wake them up, and just maybe an hour later, they're awake, and all of a sudden they can't even bend their knee to 90 degrees. So it's not that it got stiff that quick. If that was the case every time we got out of bed, we'd all be like falling apart. But it's that their brain kind of turned on and stopped them from being able to move. It increased that tone. So what we want to do as much as possible when we feel a tight muscle is to relax that tone, relax our brains. So I didn't realize this is pretty blurry, but it's just talking about the sympathetic and parasympathetic nervous system. So what I like to think of is the sympathetic nervous system is when we're running down the vault runway. We're really excited, we're focused, we're not really looking at distractions. We have one job and we are just heading all our energy to do that job. And then our parasympathetic nervous system is when we're taking a nap on a mat in the gym. We're pretty relaxed, we're pretty aware of our surroundings and things like that. So again, when we talk about balance, just like we talked about that a lot of our gymnastics skills use the same muscles and we want to balance that with other things, it's the same thing with these two systems, especially as kids during the school year. We're in school, and I know all of you are 100% of the time paying attention to your teacher, very focused on what's going on and not distracted. And same thing with your coaches at gym. So we want to make sure we balance that with some parasympathetic activity, some relaxation time, and that really allows our body to heal. So whenever we do something like foam rolling or anything that we do to help our body recover is helping us, we really want to get into this parasympathetic state. So again, also besides that, it's just bringing oxygen and blood flow to the muscles. So when we're creating friction with the foam roller or with the ball, whatever we're using, it's going to help repair our muscles. So there's a nice little video of me here from back when we were still in the gym. This is like the last week, the last day even that we were in there. And I'm using a golf ball here, but really depending on the area and depending on how big you are, you can use a golf ball, you can use a tennis ball, a lacrosse ball, a foam roller. Something hard will do a better job than something soft, but either way, it's about what works. And what you want to do is kind of sandwich that ball or foam roller between the ground and yourself, or between two parts of your body. And then you want to create some compression and then move yourself around on there. So I'll kind of skip through this video, but you just want to move around there. And what I really like to do is also move our body part that we're rolling. So in addition to rolling, once we find a sticky spot, moving that muscle by moving your ankle or bending your knee, depending on what you're doing. There we go. So I'm moving my foot there, and that just helps to create more of that friction. So where do we want to roll out? In general, any areas where we feel tension or tightness, but the biggest things that I see for gymnasts are in the forearms, the lats, so under the armpits here, the shoulder blade in the back, the pec in the front of the chest, the glutes, the quads and hamstrings, which are both sides of our thighs, behind the knees, which I'll get back to that in a second, but also the calves and then the bottom of our feet. So as gymnasts, a lot of us are pretty flexible and we hyperextend our knees a lot all the time. So the areas in the back of our knees get really irritated about that. So if you try this, even if you guys can try it a little bit later today, find some kind of ball or even like a marble for that area is probably okay, and put it behind your knee and roll around, and you'll probably feel that hurt so good feeling, which is kind of what we want to get with the foam roller. And then the same thing, something really interesting, the bottom of our feet. So obviously if we're having foot pain or ankle pain, that's important. But have been studies that show that that helps for lower back pain also. And they think that that happens because it activates that parasympathetic system. It relaxes our body. We have so many nerve endings down there, and it causes some relaxation through the whole body, even the lower back. As far as areas to avoid, so there's different things that people say about areas that you should and shouldn't foam roll. Personally, I think that any of us that try this, we're pretty smart. And if anything, we know the difference between something hurting good, like a stretching or releasing feeling, and really hurting. So if it really hurts, don't do it. I would say probably stay away from your stomach and rib area unless somebody specifically tells you to do that. There are some reasons you might do that, but overall, probably just stay away from that for now. So as far as how long and how often, so I usually say as long as it feels good. So even when I have somebody in my clinic and I'm working with them, and with all of our other exercises, I'll give them a number of how much to do. And then, but then when I have them foam roll or roll themselves out, I'll just say, I'll set a timer maybe for 4 or 5 minutes just to put a limit on it, but I just say go until you're done. So as you do this, some of you who already do it might know. But if you're not, when you try it, you'll kind of feel when things start to release, when you've gotten the benefit, and then when you no longer feel any further benefit from it. So that benefit can be achieved as early as 30 seconds. But something else to think about is if I'm going to roll out this whole list of body parts and every 30 seconds I'm going to switch, am I really going to be able to get into that parasympathetic or relaxed state? Or am I going to be just moving around? Like, how do I get my forearm? Okay, now I got to lay down and get my pec and moving around. So that's just something to consider. You know, if you feel good to lay on a certain area for 2, 3, 4 minutes, that's totally fine. There's really not much damage that can happen, again, unless you feel like something is really painful for some reason, but that's not usual. As far as how often, I usually say daily to kind of run through a list of areas that you know are tight, but increase work as needed. If you have an injury, you're sore, especially as we all get back in the gym after this time off, that might be might want to do this a little bit more. And then as far as when, So the research supports that after a workout is better. And I think part of that comes from, again, I know I keep going back to this sympathetic and parasympathetic, but it's so important. If we foam roll and we feel nice and relaxed and we feel kind of like sleepy, we probably don't want to go right into our practice, or it's going to ruin some of those effects. So after might be better, so we can kind of relax and like come down from our practice. But again, this has to do a lot with our brains, and all of our brains are different. So if you really feel better, if you do it beforehand, you feel more flexible, things like that, that's fine. That's not wrong or bad. And then as far as how much pressure to put when you're doing something like this, you want it to be slightly uncomfortable. You want to feel like you're kind of getting through the tissue. If we just barely put any pressure on it, we're just going to be getting through our skin and our fat tissue. All of us have fat. We want to get down to the muscles. So you do want to put quite a bit of pressure on there, but it certainly shouldn't be very, very painful. And that initial pain response should decrease right away once your body realizes it's okay, this is good, this is not going to go all the way through my skin, I'm just putting some pressure on it. All right, so I want to move on to massage. So this is going to refer to like actually going and getting a massage somewhere, along with massaging yourself or have a parent or friend massage you, anything like that. So the benefits and what it does and does not do is pretty similar to what we talked about before with like foam rolling and lacrosse balls. So, I've certainly been to massage therapists that say, oh, this muscle is tight, I need to lengthen it and loosen it. And then they do, a 30-minute session on me and then they say it's looser. But as we talked about before, our muscles are just too strong. That's not the case. What likely happened is their hands are kind of helping me to relax over that area. They're telling my brain, hey, you got to relax this area here. And that's what's happening. It may be, for some of us, if we can, a little bit better than foam rolling or massaging because we can actually completely relax. If we're foam rolling, we're still moving our body. We're still trying to get in the right position. Most of us might still be on our phones, doing whatever. So being on a massage table just helps us to truly relax. So that might be a little bit better. But for some of us, I know like I love massages, but my sister doesn't want anybody to touch her. Coach Allie probably feels the same way. Like, do not touch me. I will take care of this myself. I'll roll out. It'll be fine. So it's really just what's a preference to you. It is a more passive tool. So I usually like to do things that are more active and that we can do ourselves so that we can repeat them all the time and not worry and wait for the time or money or an appointment to do it. But it might be beneficial in just like maintaining ourselves. Sometimes if we're not working with a PT or a strength trainer, having somebody just get their hands on us and touch different areas can again help us to find some problem areas before they really develop into pain or anything like that. So meditation, again, we're looking at the parasympathetic state. And it might be beneficial, especially for gymnasts, because they're always on. We have pretty long practices, and they're pretty intense through the whole thing. I mean, the warm-up and cool-down, we might kind of go up and down a little bit. But if we're not working on endurance things like routine, we're working on skill-specific things and improving technique. So could be really beneficial. And it also gives you a chance to kind of relax and reconnect with our bodies. I know especially during the school year when we're not in quarantine, but actual school, it can be kind of stressful. You go from school to gym, maybe another sport, or you have some social events or things like that. And you don't really just get a chance to relax and check in with yourself. So that can be really helpful as well. And then this is one of my favorite recovery devices. So they're called Normatec boots, and they basically look like these big space boots, and you zip them up and they fill up with air and compress and relax. And I love them. I always feel great after I use them, but the evidence actually shows like mixed reviews on how effective they are or what they actually do. But it has been found that they do reduce swelling after an injury. So if you have like a sprained ankle or something and you have some visible swelling, you can put the Normatec boots on and it will reduce that swelling. And you can actually see on your skin, usually they'll leave a mark where the fluid kind of gets pushed in. So there is some evidence also about motor. flow. So that's like all the fluid in our body, and we want it to always be flowing and clearing itself and moving like that. So it might be helpful for that. But again, I want to bring us back to that parasympathetic system. So I put the boots on, whether I have a pair at home and a pair in my office, and I'll put them on and I'll just kind of zone out and relax. And it's kind of a compression and relaxation and lets my mind really kind of go to sleep almost. So compared to the other things we talked about, I'm certainly not selling these to anybody, but just in case you're wondering, they're moderately priced. It does cost about $1,500 for a pair, but it is a one-time purchase. So if you're somebody who's like always going for leg massages or always doing different things, that can add up when you're trying to go every month or every 2 weeks or something. So the good thing is it's a one-time purchase and then you have them. One study I did find, it's kind of an older study in 1995, so it's probably a whole different kind of compression than what they use now, but it did actually improve soft tissue stiffness and tightness for up to 5 days. So that's pretty cool, especially when we get in the season, or if you play another sport besides gymnastics and you kind of have to go right away from one meet and you have another meet the next weekend, or maybe you have a soccer game and a meet in the same weekend or something like that. It can kind of help you to get through all that a little bit better. So the next thing is kind of cool. It's called flossing, not your teeth, but your muscles. So out of everything that we're talking about, this has a bit more evidence for actually getting through to the muscle tissue. So basically what it is like a elastic band. So it's a little bit different than like a TheraBand that some of you guys have, but pretty similar. And sorry, somebody's trying to get in, trying to let them in. There we go. And you wrap it around an area of your body wherever you're feeling some stiffness, and you wrap it pretty tight. And basically what this band does is attaches right to your skin. And so when you move, your skin can't move very much. It creates some friction there where it can't move. So then your muscles and some of the deeper tissues are able to move. So it's pretty cool, and it can be pretty helpful, especially compared to like a foam roller or lacrosse ball. You can only get one side of your leg or something like that at a time. Where if you have stiffness all in your calf or in your forearm, this can get both sides at the same time. But the frustrating thing, if you're trying to do more of like a maintenance routine, it is a little bit, it's a little bit hard to wrap it and unwrap it. So I wouldn't want to do this for more than like 2 or 3 areas of my body, or it will just take forever. But it's pretty cool, and these are pretty cheap. I think I got like a pair off Amazon for like $8 for 2 of them. So if you always have a specific area that's sore for you, it might be worth giving a try. The next thing I want to talk about is cryotherapy. So I don't know if any of you guys have seen like a full body cryotherapy machine like this. It's pretty crazy. It gets to like, this one says negative 200 degrees, but I've seen some that get like negative 300 degrees. It's really, really, really cold in there. And the idea is that it helps to improve blood flow, it burns calories and things like this. But the evidence does not actually support any true benefit. And a lot of people do say that they feel better. A couple years ago, a lot of the big colleges and things like that bought these units. They're like $60,000. They're super expensive. But the athletes like them. So, you know, that's one thing. I don't really know as far as burning calories. We're all athletes, and we get a lot of movement. And I think burning our calories through movement is better, making sure that we're eating enough than just kind of standing here and freezing. So something that I thought, because a physical therapy place I used to work at had one of these cryo machines. So I would jump in there every once in a while and try to figure out, you know, if it helped me or what I felt. And one thing that I thought is that as far as blood flow goes, we know that cold decreases our blood flow and restricts it. So I was wondering why they kind of claim to improve your blood flow when we know it's cold. And I know when I was in there, it was so cold. My hands were blue, my feet were blue. I didn't really have blood. I felt like I didn't have blood anywhere. But once I got out of the machine, all the blood kind of came back. So I'm wondering if, what they're saying, or one mechanism could probably work is that if our blood is not flowing so well, or we have some areas where it's not working, and then we restrict it and then we open it up, that it kind of like unclogs the pipe. It kind of gets that blood everywhere. It is super expensive, and it can be dangerous, especially for younger kids. So you can see this lady's head is right out of there, but all these fumes, this carbon or nitric oxide, is like right below her face. So if you're a little bit shorter and you start to breathe that in, you can pass out, and that's not great. So that's all I'm going to say about that one. I'm going to move on to Epsom salt or magnesium baths. So it's not been proven that when you do this, that the magnesium actually gets through your skin. So magnesium is supposed to be good for muscle tightness, but really when it's ingested through your mouth, it doesn't actually, they haven't been able to prove if it does get absorbed through your skin or not. But people really enjoy it, and this has been something that's been around for many, many, many years. So likely what's happening is the effect of the warm water that actually helps, and it helps with improved blood flow and that parasympathetic state. But something to say is there's few side effects to Epsom salts, and it might be worth a try. It's something really easy. You can buy a bag at like CVS or the grocery store, use the bathtub in your house, and it's a really cheap way to kind of get your whole body at once while also relaxing and not having to worry about each body part having to get through. As far as vitamins and supplements, so I'm not going to really speak in any detail to this. That would be for a doctor or a nutritionist to do. But just a few points that I want to make as far as recovery, that a lot of them are not regulated. So it can cause issues with the NCAA and different governing bodies. If you take a supplement that you think is just a vitamin or something like that, but it might have an ingredient that's not allowed by your school, by your team, depending on what you're doing. They're not as good as whole foods. So if you want to take a vitamin, probably the better things to do is eat foods with a lot of vitamins in them. Just better for us all over. And also some different genetic differences can cause us to not be able to break down certain supplements. So like for myself, if I take vitamin B in a pill form, my body cannot break it down and I get really sick from it. But if I eat foods like spinach that have a lot of vitamin B in there, I'm fine. So it's probably safer usually to just go with the whole food type. Some vitamins you can overdose on, so be careful. If you do need them, you might do, because of a variety of factors, so either permanent or temporary dietary restriction, like you're very allergic to certain foods or certain vegetables and you need to get those vitamins somehow. Or you're just traveling, you can't really get to good food sources, you might benefit from it, but it's always better to see a doctor to kind of guide you with that and not just go to the vitamin store and pick up whatever you think sounds good. Okay, so that's a lot of the techniques there, but something that I want to discuss is even if you do all these things, so you use your Norm Tech, you foam roll, you use your floss, you take Epsom salt baths, you get massages, you see a PT all the time. But if you do all that, I like this picture. It's like shooting a cannon from a canoe. So it's not a very stable surface. If you don't have proper sleep, basic nutrition, and the ability to honestly check in with your body and how you feel. So I didn't actually get the citation for this study, but I saw it recently that youth athletes who slept 8 to 9 hours per night had a 50% less injury rate than those compared that slept 6 to 7. So I know sometimes you can feel like, oh my gosh, I have school until 3, and then I have clubs until 4, and then I have practice from 5 to 9, and I have to be up, and I have to eat and shower and all this. Hopefully you can kind of work out that schedule, but sometimes if that means missing one practice to finish homework or leaving 20 to 30 minutes early, if it saves you from being out of the gym for 3 to 4 months with an injury, I think that's a lot better. So that's something just to think about the big picture. And then basic nutrition, you can always check in with a nutritionist about that, make sure you're getting it. And then the ability to check in with your body and how you feel. So all the techniques that I mentioned above are going to work a lot better when you can think, okay, I tried foam rolling and I felt a lot better. But I tried that flossing thing you said and it didn't really help. Well, it's going to save you a lot of time once you can come down to that And once you can kind of check in and say, my shoulders feel really tight today, so I need to foam roll those. I only have 5 minutes. I'm going to focus there versus just kind of blindly doing your whole body there. So those are the most important things. And then you can look at all the details of all the other things that I talked about. So which one do I do? Whichever one you enjoy. Kind of made the point as we go back that all of them are really focusing on our parasympathetic state, helping us relax. So some of them might be enjoyable for us. Some of them might not be enjoyable for us. So you want to take that balance. However, if you tell me, you know, what makes me feel really great is if I take 10 Advil every day, that's not going to be so good. That has side effects. So we want to stick with these more active treatment modalities that have less side effects. So what if you don't feel any soreness or tightness? So usually what I find is that if you're a competitive gymnast over about 13 years of age, if you're competing about the level 8 or equivalent, or if you train 15 hours per week, if you kind of fit into any of those groups, it's pretty likely that you do have some imbalances or tightness. So you might want to check with a provider and just let them assess you and kind of help you realize in your mind where those areas of concern might be, or if you truly don't have any, that's great. But just making sure you're really thinking about it. On the other hand, if you say, I always feel sore and tight 100% of the time over most of my body, I foam roll, I eat right, I take baths, all this, but I still feel sore and tight, nothing helps at all, then that's a cause to go see your doctor because something else might be going on that's causing all that. That shouldn't really be the case either. So something else that I just wanted to touch about, this isn't really about maintenance, but just something that I think is important to discuss. So what if I'm already injured? They used to always say to rise it, rest, ice, compress, and elevate. But that's not really the case anymore, what they're recommending. So now they talk about peace and love. So protecting the area, elevating the area still, but actually avoiding anti-inflammatories. We do want some of that inflammation process to take place, and taking things like Advil and ibuprofen stops healing a little bit. Compressing it is still important. Educating yourself and getting educated on what to do is important. Loading, so when it's appropriate, getting back to your normal activities as much as possible. Being optimistic, keeping that brain in the right place. Getting blood flow to the area and exercising are important. So definitely more of an active approach now that's being kind of promoted there. So some other modalities, if you are injured, things like taping, scraping, dry needling, cupping, those things aren't really in the scope of this discussion. But I can always do another one regarding those things if there is interest. And then if you guys do want to reach out to me at all, my practice is in Fairfield, New Jersey. My website is there. I do have a group on Facebook where I kind of post when I'm doing these type of discussions and other things related to gymnastics injuries. So feel free to join. Instagram, email, and my phone number there. You can call or text anytime. So that is all. What questions do you guys have? Go ahead and either unmute yourself or type in the chat.
Hi, Coach Dana.
Hi.
I'm sorry, my internet went in and out, and that's why I was trying to get in 20 times.
Okay, yeah, I kept seeing you, and I was like, I think I'm letting you in, but I'm not sure.
My bad. Okay, so I'm at practice, and someone rolls an ankle or, rug burn, bumps their toe, something like that.
Yeah.
Our immediate reaction is to try to alleviate the pain pretty quickly and get some ice.
Yeah.
What do we say and do or tell the gymnasts that their first reaction is, well, I want this to feel better, so I need ice now. And you're going, you don't really, and how do we make that judgment call for someone that might be in a lot of pain and we think it's not that bad?
I think if they're feeling a lot of pain, then it's okay. So I should have kind of added that caveat in there, that even though ice has been actually found to not help with inflammation, it does help with pain. So if somebody rolled their ankle pretty badly, they're sitting, they don't really feel like they can walk on it or something like that, go ahead and give them some ice. They're crying, they're anything like that, go ahead, give them some ice, because getting them out of pain is going to be most important. If they're super stressed out, they're in pain, they can't calm themselves down, they're not going to be able to kind of move past that and get any blood flow there, anything like that. Conversely, if they rolled their ankle and they're like, oh, I don't really know if I can vault, but I'm walking around okay, probably tell them, like, go take a lap around the gym, go walk to the hallway and come back and see how it feels. Something like that might be okay. And telling them, you know, if you go and you walk out to the hallway and you come back and you still really feel like you need an ice pack, then we'll put it on. I think there is a difference between like immediate injury care, this just happened right now and I'm freaking out,
Right.
versus saying like, okay, I sprained my ankle 3 weeks ago,
Right.
and still putting ice on it.
So that happens a lot. I it's one of those things where it's like we've had a lot of girls that have had that. Oh, I'm feeling some pain now. I'm gonna go ice. And
Yeah.
them making the call when it's like, I'd rather them sit there and stretch or foam roll or do something else that might help. But I wasn't sure, you know, how I'm gonna have to be able to explain that to the girls in a way where that's not the first go-to, you know.
Yeah. I think, yeah, it's definitely tough, and it's tough because that's kind of always our go-to, like I'm going to go put some ice on. But I think the best thing to do is just try to explain that the ice is not going to help heal their injury and blood flow is, so that you want them to at least try a more active treatment. But also never denying somebody to ice if they're really feeling that pain, and that's what's going to happen.
Cool.
So Julie asked, will rolling out help improve flexibility after stretching? So yes, what I usually say is that something like rolling out will temporarily improve your flexibility. So I would actually roll out and then stretch a little bit more, or you can even sandwich it, stretch a little bit, roll out, and then stretch again. But it will help make a temporary improvement in your flexibility. And the best thing to do is some active exercise to kind of try to keep that improvement going. Does that answer your question? How often to roll? So, I mean, I would say like every day, as part of every day that you practice, or even every day, even when you don't practice, as part of a routine, just to get used to taking care and maintaining your body. Is not going to take care of itself. And I think it's important that the athletes kind of get in a habit of doing it on their own, because, you know, in practice, we have 2 hours, 3 hours, 4 hours, however long we have, but we have to teach skills, routines, everything like that. So it may be a little frustrating as a coach to say, okay, 10 minutes, everybody just roll out. I don't know about that, but I think the kids getting used to kind of doing it on their own and taking care of themselves and knowing how much. I think, you know, all the athletes in here and anybody else kind of knows, am I somebody who's really tight and I get sore and I really have to focus on my flexibility? Or am I somebody where my joints are pretty healthy, I feel pretty good, I don't feel that tight, and maybe I only need to foam roll 2 or 3 times a week after a real tough workout or something like that. So Patricia asked, I know we didn't talk about taping, but does KT tape actually work? So kind of like a lot of the other things that we talked about, it can actually work, but a lot of times not in the way that some people say it does. So when it first came out, people said, okay, we have to put the tape from here to here and it's going to turn on a muscle or turn off a muscle or something like that. And that's like pretty wild when you think about it. It's just a piece of tape, it's just on your skin, is not touching the muscle. So how can it turn it off? So that's kind of been disproven that can happen. But there are a few things that it can do. So again, I know it's crazy, but getting back to our brain, just by having some tape somewhere, our body calls attention to it and tries to make that body part work better. So even, you know, I don't have a problem, but if I put some tape on my bicep, my brain would automatically say, let's pay attention to this bicep and make sure we're doing everything perfectly. There might be something wrong, and let's just kind of check in with it. The other thing that it does, 2 other things it does. So one thing is that the tape, when you get it, it's actually already stretched out. So when you put it on your body, I'm going to exaggerate this obviously, but it kind of pulls your skin up a little bit like this. So it allows for some fluid in your blood to kind of flow underneath it a little bit more. So where it might be like previously restricted blood flow, it's able to flow a little bit more. And then with that, kind of on that same topic, some of you guys have probably had like a really bad sprained ankle where it bruises or something like that. Or if you play another sport, if you got hit with a softball or something, you get a big nasty bruise. Same thing, you put that tape on there and it pulls the skin away and it allows that blood to kind of get out of there. So it does work. I mean, it's something that I use on myself. I use on my patients, but not as much in like turning muscles on or off or anything like that. Does that make sense? What other questions do you guys have? All right. Like I said, you guys have my information if you saw that last slide. If not, most of you already know me and where to find me. So if you do have any other questions, just let me know. And my Tumble Text friends, I will see you in about 15 minutes for our workout.
Bye, thank you.
Bye, you're welcome.
Thank you.
You're welcome.
You're a true whiz. I love you. Bye-bye.
I try.